suffer from ongoing back, neck, or joint pain? Chiropractic care just might be the answer. Many people have never been to a chiropractor. Some have gone to one, but haven't had the results that they were hoping for. Not all chiropractors are the same. There are over 43 different specialties in the field. Some specialize in accident injuries, some in sports medicine, some even practice in nutrition and pediatrics. Chiropractic care has something for each of us. You just need to know what you're looking for, and that's where we come in. There are a lot of misconceptions out there, and our goal today is to clear up some of those for you. First, we are going to hear from an accident and rehabilitation specialist who has dedicated his life to helping people regain mobility and optimum health after a car accident.
I'm Dr. Jay Shetland. I'm a chiropractic physician in South Jordan, Utah. Been here for about 8 years, but I've been practicing for a little over 17 years now. I've had the opportunity of living in Asia, so I was able to study how people look at healthcare there. And I've actually had the opportunity to practice in Europe, in Portugal. And it was really neat to live outside of the States as a American physician, so to speak, and really get a grasp of how healthcare is different outside of our American bubble and the way we look at it. So the nice thing with living and practicing in different parts of the world is it gives you a different perspective on health. I'm not just dialed into, and this may sound harsh, but the disease care model that we call healthcare in America, but a true healthcare model looking at the Asian lifestyle, the European lifestyle, and the American lifestyle, and how these all blend together and where they meet properly and where maybe sometimes the rubber doesn't really hit the road as far as healthcare goes and staying optimally healthy. So it's been a really nice experience, a nice professional experience living and practicing in these different areas. And what it's taught me is that true health comes from within, and we have to have the right simple things. We shouldn't be looking for pills and potions and lotions to try to help us be healthy. We should be striving to get better sleep, maximize our nutrition, avoid toxins, and of course in my world, keep our nervous system functioning properly so our brain and our organs and tissues and muscles are all working at their best. There's no other trauma on earth that compares to an auto accident. We look at falling off a ladder, it's us with gravity against the earth, which is equivalent to us hitting the earth with the speed of gravity. But in accidents, you've got different size vehicles or mass in motion in different directions, and so it can really complicate the forces that apply. So they're a very complicated trauma to rehab from when they've taken place. And that's why I always suggest to people that they see a certified specialist, somebody who really knows the ins and outs of auto accident physics, both to the vehicle and to the occupant, so that they can properly rehab after an injury. So when someone does have a motor vehicle collision, their life changes in an instant, where all of a sudden they were on course, everything was normal, and it's completely deviated to another path now that's going to require possibly litigation where they might have to have an attorney involved in their case. The insurance is going to get involved. They might have to be missing part of their work or not need help with simple things at home like cleaning their house. I mean, there's a lot of course changes that can happen in this, and to get a proper course correction as fast as possible, to get them healed up properly and properly taken care of financially, it usually takes a team of specialists, and that's where you want to have those certified specialist physicians and attorneys so that as a team they can handhold that patient back to a normal life, at least as close as we can get. Some people are never the same after an accident, but most of the time, if it's treated right from the beginning and we follow the right recipe, and there are proper recipes to follow to get people better, then they can get their lives back on track. I often have people come in and like, well, it was just a small impact. I don't think I was hurt that bad. But you and I as human beings are designed for walking and running under compressive forces. If our disc is here and these are our bones, but a shear force, like a 3,000, 4,000, 5,000 pound vehicle shoving us from behind or from the side or a sudden stop, we aren't designed to handle those shear forces. So I suggest anybody that has an auto accident over 5 miles an hour get checked, because there may be some hidden injuries that they don't know about, and they'll catch up with them later. After an injury, most of the times we're hurting, and obviously there are times we're hurting enough where we need some medication to help palliate the symptoms. But medication doesn't heal the tissues. It just reduces the swelling, palliates the symptoms. What we want to do is rehab those tissues that have been injured. And the research shows since the 50s that the 3 physical medicines combined, chiropractic, physical therapy, and massage, the right modality and the right time in the care of the case, is the secret sauce to really get people better faster, most cost effectively.
Are you interested in what you've heard so far? You can find us online at utahchiro.org, whiplashgroup.org, or call us at 385-257-1700. When we come back, we're going to be talking to a chiropractor who has helped me overcome pain and illness in my own life. Stay tuned.
Here at Red River Health and Wellness, we focus on functional medicine, and what that is dealing with chronic conditions and autoimmune conditions, but in a very specific manner. Rather than just treating the symptoms, which the conventional model of medicine will do, our whole focus and goal is to try to identify the underlying mechanisms that are causing these issues. And so, for example, if a patient is suffering with autoimmunity, they might go to a doctor and get on a medication for their symptoms, but nothing's being done to the autoimmune disease that is causing it to flare up. Here at Red River Health and Wellness, our goal is to get to the mechanism of the issue. Rather than just treating symptoms, we want to identify what is causing the autoimmunity to flare up and then work at that lower level to really have a profound impact. And this is fascinating. There's lots of things that we can do with dietary, lifestyle, and nutrition that can have a profound impact for autoimmunity and chronic diseases. Just simply working at this underlying issue, instead of just treating symptoms, really customizing a specific treatment plan for each patient can make a huge difference in these patients' lives. Our biggest goal here is to really help teach them and educate them and help them be empowered so they know what to do and what not to do for the rest of their lives. And that has been shown to have a profound impact on each patient that does. We're using evidence-based medical testing. So rather than relying on tests that may be guessed off of theories and guesswork, we now focus on blood chemistry and medical testing to identify how we can help these patients with nutrition, supplements, and dietary and lifestyle changes. And so just being able to see blood work side to side and be able to walk through the blood chemistry, we can know exactly what foods the patients can eat and what they should avoid. What we do rules out all the guesswork. So many patients are eating a diet or going from doctor to doctor not knowing and kind of guessing what's going on with them. We don't want to guess. Like our whole goal is to identify exactly what the specific issues are for this patient and then customize a very personalized treatment plan for them to get better.
I just wasn't feeling good. I had a lot of skin issues. I couldn't lose weight. I was feeling depressed and really low energy. I didn't think it was that weird at the time, but yeah, compared to how I feel now, I was feeling pretty crappy. When I first started coming to Red River Wellness for my first consultation, the doctor met with me for 30 to 45 minutes, and I had never had a doctor meet with me for that long before. I had been to lots of doctors in the past, and they just did a couple tests and said that I was fine, and I knew I wasn't right. I just knew that something was off. But here I felt a lot of validation. They did a lot of blood work and blood tests that, again, completely validated all of my symptoms that I had, and there was a real problem, and then I was diagnosed with Hashimoto's. So I've been coming here for several months, and they've been treating everything with diet and supplements and then doing continuous blood work. I can't even tell you how much more energy and how much better I feel now. It's kind of amazing. And I haven't had caffeine for probably almost a year now, and my energy, I've never had better energy in my life. And I just feel good. I wake up feeling good. I go to bed feeling good. I sleep better. My emotions are a lot more steady. There's a lot less roller coasters there, and my skin has cleared up drastically, and overall I'm just, a lot happier and healthier.
Dr. Red is simply amazing. He has helped change my life in so many ways. Now, chiropractic and functional medicine can help with so many health issues. When we get back, we'll meet a doctor who is changing the lives of expectant mothers and newborn babies. Welcome back. Our next physician specializes in helping expectant mothers maintain great health before and after their pregnancies. Beyond that, she also works with infants and children and rounds out her practice with a family-centric approach to chiropractic care.
So a lot of people ask me why, as a chiropractor, I see pregnant women and babies, because it's not the typical thing to see. A lot of people think of chiropractic as more back, neck related. And my first answer is, well, chiropractic is all about the nervous system, which really goes back to how our bodies are meant to heal and repair. All of our bodies are in a constant state of change and repair. But in order to do that, our bodies have to follow a very precise program. As long as that program is working properly, then everything should function properly. Our bodies should heal and should work. But if there's an interference in that communication system, which is from our nervous system, our brain, our spine, our nerves, if that computer command center isn't working properly, then our bodies don't do what they're programmed and designed to do at any age. And that's my job as a chiropractor, is to help that communication system work better so that the body can heal and repair and work like it should. I see a lot of pregnant moms because first, pregnancy is a normal and natural condition. It's normal to be pregnant. It's also one that we look at often of saying it's just something you have to put up with how you feel. And my answer is let's empower women, let's empower couples to be healthier from the beginning. But women who are under regular chiropractic care have better pregnancies, less pain, less discomfort, but they feel better, they function better. They normally go full term, which is a good sign. And then during labor, they have a faster, easier, more efficient birth. And that's something that we all want as women, is to have a faster birth. But it's one that we also find that our babies that are born come out healthier. They don't have the breathing issues. They don't have the latch issues like some of the other babies are having. So it's really about setting up the next generation to be healthy from the very beginning.
So I've been a doula for 21 years. Over those 21 years, the women that I've been sending here for chiropractic help have better blood flow, they have better alignment, they have shorter deliveries, they have overall better health. Also, newborns getting adjustments because of going through that birth canal, it can help them tremendously. I see a lot of babies with some neck problems. They come here, the adjustments are simple, they're calm, they're done very softly, and babies can breastfeed better and can adjust to life outside of the womb so much better.
The nervous system develops the most in the first 3 years of life, yet it's the one system that is never checked medically. We check all the other systems, but no one checks the nervous system for proper function and for optimal function. That's what a pediatric chiropractor does. If we help the nervous system work properly, the baby's going to develop properly. We find that babies that are born, they're having nursing issues is a cardinal sign of some issues at the beginning. They're not nursing properly, or they pick one side to nurse on better than the other side. And moms are told, well, that's normal, they have a preference. My answer is that's not normal. You don't produce chocolate milk on one side and normal milk on the other. That's not normal. Baby's not able to nurse properly on each side. But if that's not fixed, then these babies not only will stop nursing, but they go to have the typical ear infections or the colic and the fussiness and the gas issues. That's just normal or common for a baby. The babies that come into our office, they're able to nurse better, which means that they're able to sleep better. They don't have the colic issues like the other babies, but then their immune systems are stronger because the nervous system controls the immune system. Each adjustment boosts the immune system to work even better, so our babies don't get sick as often. The benefit that I will take even further is that these babies develop normally. They develop healthy like they should. They meet and exceed their milestones, which means that their brains are developing like they're supposed to. As a parent, my biggest goal for my kids is to be at their healthiest and be at their smartest. I want to know that my kids, and I've really set them up for the best life possible, and that's what our families are doing. By getting kids under chiropractic care at a young age, it's not to treat a condition. It's not to treat a problem. It's instead to grow them healthy. It's all about how we perceive the world is through our nervous system. So let's make sure our nervous system is working at its best so we perceive life fully and we really integrate and we're fully involved with our relationships and with our homes. My biggest hope that I give as a chiropractor and as a mom is that we don't know what the body's capable of and its potential unless we start unleashing it. And I look at my job as pulling back the layers of potential and seeing these kids come alive and these kids fully engage with their families, because that's really, to me, what life is about, is connecting our generations and really enjoying being a mom, but also enjoying being a kid and having an amazing and full life.
Isn't she terrific? I wish I had known about her services for all 15 of my children. Seriously though, a healthier pregnancy, easier delivery, and healthier babies, I mean, what more could a girl ask for? Don't go away now. In our final segment, you're going to meet a chiropractor who has made a career in keeping professional and Olympic athletes in the game. Okay, sports fans, this is the doctor that you have waited for. Now, he has spent the past several decades working with professional and Olympic athletes, helping them to get the most out of their performance and careers.
Chiropractors focus on the spine to make sure that all the vertebrae are moving properly, and then the nutritional aspect. But we're trained as primary care physicians. By law, we have to meet a certain level of expertise in order to practice in the state. After I graduated, I opened a practice up in Salt Lake, and a month later, I was interviewed by Don Sparks, a trainer for the Jazz. It was the Jazz had just moved their franchise from New Orleans to Salt Lake, and they were interviewing for Team orthopedist, team internist, team podiatrist, team dentist. So I just happened to be at the right place at the right time with the right skill set. And the first player he brought in to me was Adrian Dantley. And AD had had some back problems all through college, and he was struggling. And I evaluated him and started treating him, and the pain went away, and that was my end of the Utah Jazz. My relationship with the Jazz opened up a whole world of possibilities for me. And I was able to prove the system that I use at the elite level. And it worked really, really well. We had the lowest player missed game due to injury rate of any team in the NBA for the 20 years I had access to players. We had a few years we only had 11 player missed game due to injury for the entire season. That's unheard of. And that's how I got involved with the NFL. So during the lockout, the NBA lockout, I had an opportunity to work with the Denver Broncos. And that was during the first year that they won the Super Bowl, and I got to work with some of their athletes. But it gave me an opportunity to challenge this work at that level. Those guys get hammered every game. So then I had an opportunity to work with Coach Richard Quick from Stanford University, who was a women's swim coach, the winningest women's swim coach in the history of swimming. And that was the year that they had the trials. And so I worked with a number of his swimmers, and they did well, and they went to the trials, and 2 of them made Olympic teams. Summer Sanders introduced me to Coach Quick, and I got to see the value of this work in helping swimmers perform better. But what's most rewarding is when I find an athlete who's had an injury and had surgery, who's gone through a year and a half of rehab and still can't quite get past the pain, and they're ready to give up. And once I evaluate them and I define where the problem is, and they start to see the changes in function, then the thing that's really cool is you see that spark of hope come back, and they realize I can come back. And they not only come back, but they go on to make Olympic teams, and they go on to win medals.
In 2004, I broke my leg and I had a rod inserted and removed, and I was just in a lot of pain. And to get back to skiing, I had to do one-legged squats for 2 minutes, and I couldn't do that. And I came in here, my friend told me about them, and I walked out pain-free doing one-legged squats, and I was ready to ski. It was impressive, and I was sold right then. I've been working with Dr. Bueller since 2004, and that means I've been with him for 13 years. And he has been a big part of a lot of my comebacks. What I do is very dangerous. You can get hurt, the careers usually don't last too long, but I've been through a lot. I tore my Achilles, I've broken my legs twice, I've recently blown my knee out, and he's been right by my side, and he's got me back to the top of my game each time, and I've become a better and better skier every single time. To say I'm pain-free is something that brings a lot of confidence. I'm standing on top of an icy slope on a steep mountain, and I'm willing to huck my body down that thing. And if I am full of pain, I'll be hesitant. And when you want to win and when you want to do really well, you have to have that confidence that you know you can ski that bad boy line, or you can really risk it here or there. And with pain, you tend to back off and not really take those risks. So being pain-free and being full of confidence is a big part of my game. Not only has Dr. Bueller made me pain-free, I'm 35 and I'm still ski racing pain-free and ski racing better than I ever have.
So many young athletes have to quit their sport because they're hurt or they have surgeries that aren't necessary. This work helps people avoid surgery. So there was a study that was done a number of years ago in Illinois, and there was a doctor, an MD, who had found that chiropractic physicians were well trained to deliver primary care. So a program was instituted with 700,000 covered lives in a Blue Cross Blue Shield program. And so those participants met with the physician, and once they were evaluated, the physician would determine how much care they needed. At the end of 2 years, they had a 58% reduction in pharmaceutical use, a 65% reduction in hospitalizations, and an 85% reduction in outpatient surgeries. it accounted for 66% reduction in overall costs. Think about that. You've got the hospitals and the pharmaceuticals who are involved with this healthcare system, and you've just delivered data that supports the fact that you're going to reduce the utilization of their services by that much. Nothing ever came of that data. Nothing ever changed. But we have a healthcare crisis in this country right now. And we've got an opioid epidemic, and there are over 100 published studies that show chiropractic is as effective, if not more effective, than drugs and surgery without all the side effects. Why aren't we being used more? Why are we carved out of most insurance plans? Those are questions that we should be asking. And the public needs to know that there's an option, a safe alternative approach to health care that will produce a lot better outcomes, especially when you integrate it with good quality medical care. There's no shortage of sick people in this country. So why can't we come together as a healthcare delivery system and create something better than what we've got, utilizing everyone's skill set?
Hopefully we've expanded your point of view on chiropractic care. Thousands of lives have been changed for the better through the work of these trained physicians and professional caregivers. Isn't it time to stop hurting, stop feeling sick, or having no energy? Get the joy back into your life through optimal health, the help you can get from your own chiropractic care. We can help you find a chiropractic physician near you. Take your life back now and call us today.